charge of my well-being. Take it as a challenge. Overcome it. Hey guys, welcome back to Cultivating Harmony. Today I'm going to be sharing with you guys my breastfeeding experience while having Raynauds. If you haven't already, go ahead and hit the subscribe button. I am fortunate enough to now have been able to successfully breastfeed 3 babies, and I wanted to share that it's possible to have a very normal or extended full-term nursing relationship even while having Raynauds, as well as some tips that help me out along the way that aren't just, applying hot compresses. One of the things that prompted this conversation is that I have several friends who are pregnant right now and have in the past struggled with breastfeeding or have been unable to breastfeed, and I'm seeing more and more people kind of speaking out about this online even, but I didn't really find any positive stories and very few stories at all about having Raynauds and breastfeeding. So with that, we'll go ahead and get started. I do want to just share that, mastitis is not the same thing as having Raynauds. Now, I know both can cause pain. However, with mastitis, it's generally felt throughout the breast tissue as well as, even into the armpits where you can have milk ducts. People who have been diagnosed with having both, but in Chinese medicine term, mastitis is actually most commonly caused by negative emotions that are causing blockages. Since the liver meridian actually runs through the chest region, some of the emotions that affect the liver are things like stress, anger, resentment, feeling stuck, or even just repressing negative emotions. So experiencing these types of emotions while breastfeeding or just throughout the day, if you're a nursing mother, will actually cause your milk or your ducts to clog, and like I said, you experience those, painful blockages. This was not the case for me, thankfully. I know there are natural remedies for mastitis, things like hot compresses and massage, sunflower lecithin. So by keeping your liver meridian clear and flowing, you're actually going to be able to keep those from happening in the first place, which I think most of us want to do. If you would like to do this with foods and doing, more of a natural, organic kind of way, go ahead and check out my video about spring foods and the liver meridian. I'll go ahead and link that for you as well. So as I shared, I have now successfully nursed 3 babies, 1 full term, 1, 2, 3. That relationship ended for another reason not related to my Raynauds, and I'm on my way to completing my 3rd full term nursing relationship. So I just really want to put out there that, most doctors and clinicians in general don't really know what to do with people that have Raynauds and affects breastfeeding. So we're kind of in this gray area and kind of get lost in limbo. So I just want to share that there are successful stories and you don't necessarily have to give up your relationship. There are other ways. So you can do it too. I also just want to add, because breastfeeding videos tend to be kind of controversial, that, there's no shame in, whether you're breastfeeding or doing this or doing that. It's important to acknowledge that we're all dealt with different cards in life and we have gone through different experiences and we start our journeys of motherhood at different points in our life, and that can lead us to make different decisions and different times about things. And so I am just sharing my experience, hoping to, share a little positivity. So before I go into each of my breastfeeding journey stories, I do also want to say a couple of things that I think maybe also influenced my situation. And the first of that is that all my births were, natural, normal, home births. And so I don't say that for any reason other than to put out there that medication or drug factor into my Raynauds or being able to breastfeed. I know that it's very common for mothers who have had epidurals or other drugs during labor or even C-sections to be unable to breastfeed just because they're not having the natural cascade of hormones. If you don't already know about it and you're kind of more a science person, go ahead and type in birthing hormone cascade. You can find a lot more information about that. But when you're not having the natural progression of hormones being triggered, a lot of times mothers struggle or can't at all breastfeed. They don't make any milk or, whatever. So I just want to say, like I said, that wasn't a factor for me because I did have a home birth. You can kind of, discount that from the possibilities for me. So another thing about being a home birther is that I think that the home birthing community is, very hardcore or very, pro breastfeeding. And so I think, especially being a first-time mom, it really helps to have those connections and have that kind of support behind me of saying, yeah, you can do it, and, don't give up and things like that, because especially as first-time mom, you may not know other women who have breastfed, and so sometimes it can be difficult to find those connections and those kinds of relationships where you can talk about these things. Another thing that I think helped my situation is that mentally, I was prepared for a difficult breastfeeding relationship. I think overall, I was really determined and set on one way or another, I was going to nurse my baby. And I really prepared my husband also for that, to be, another advocate for me. Because postpartum, you're very vulnerable still, and so it's easy to feel really depleted and overburdened and overwhelmed, and you feel like you can't fight all the battles. And you have people who also well-meaning, but tell you, okay, well, a fed baby is a happy baby. But I also like to point out about, what about mom, and it's not even just, is mom happy? But, nursing is such an instinctual part of women, and so when they're unable to do that or struggle with that and have difficulty, it's very hard on us on a level that you can't really explain, and I think other struggling mothers can understand. It's just not really something you can put into words, and it's something that you really feel deep inside that can be very traumatic. Yes, we all want a, fed, healthy, happy baby, but mother is important as well. So part of me being very determined that I was going to nurse my baby one way or another really just comes from a place of mindset. I found out during pregnancy, that many mothers struggle. Many mothers can't nurse. And so I really wanted to have a successful breastfeeding relationship. And I really anticipated it being difficult and it being a struggle, as well as having my home birthing community. I did take a breastfeeding class. I'm not sure how much that helped now looking back on it. But, I had read a lot online as well at the time. And, I was even prepared to, if I had to, I looked at the human milk for human babies and supplementing with real breast milk if I needed to. I also looked at things such as domperidone, which is kind of like an off-label medication that helps, mothers who don't have a supply. So like I said, I was mentally prepared, did a lot of reading, and was as prepared as I could with, if it doesn't work or if I have XYZ problem, what am I going to do to solve it? Trying to be proactive, having as much knowledge as I could at my disposal, because I knew that once you have the baby and you're in the middle of it, right, it's going to be a lot more stressful. You're going to be, just not in the mindset to take on some of these more difficult emotional and physical issues. So I'm going to go ahead and share each of my nursing stories because, to be honest, they get better with each one. But I think that some of the information, going from my first, second, third, is kind of important to share. So I'll go ahead and put the times for that in the description box for you guys as well. But we'll go ahead and start with my first birth. And so with my first baby, I had a relatively normal home birth. It was a long 26 hours of active labor, but baby arrived and I had put the baby on what I thought and was nursing baby, and everything seemed normal. But about, I want to say, a day or two later, the baby was looking just barely slightly jaundiced. So my midwife had suggested that I take baby to the doctor just to be safe. I think the baby had lost maybe a few ounces, but it was really nothing significant, but just to be safe, just to go ahead and check. So we did do that and took baby in, and the doctor said, no, baby looks great, just keep nursing. But I think we realized that at some point that actually the baby was not properly latched. I was having some discomfort, but it was nothing too big. So we ended up having a lactation consultant come into the home, which was really nice. I had already known about a lactation consultant because she was one that is the go-to in the home birth circle. So she's really, familiar with coming to people's homes and things, which was really great postpartum, by the way. So the lactation consultant actually came in, and she actually was able to get baby to what I know now is to properly latch, and holy moly, and anyone who with Raynauds will know what I'm talking about. The pain was so acute and unbearable, it had me in tears. And mind you, I just had a 26-hour home birth that didn't hurt as bad as what this latched baby was causing me. So that really speaks to the extent of how painful having Raynauds is. Yeah, I was really just, crying through the whole experience, and and it was on both sides. This is why my baby has been losing weight. The baby hasn't even been latched properly, and that's why the pain was so much more than it had been the few days previous because the baby wasn't latched right and wasn't probably getting enough milk, and that's why it was only causing kind of like a mild discomfort. But once baby was latched and getting milk, it was awful. We tried a few different things. The lactation consultant basically came to the conclusion that I most likely had Raynaud's. And what's funny is that she had said, I never actually have seen a case in real life of Raynaud's with nursing. It's just something I've learned about, and you technically fit all the criteria. What kind of was also the light bulb for me is I had been diagnosed, I think about 10 or so years previous, with having Raynaud's in my hands. So it kind of made sense. It wasn't totally left field, but it definitely was not something I was at all considering affecting my nursing journey. And I was really just left to pump because pumping was bearable. So one of the things I had read about is that, as soon as you give a baby a bottle, they're not going to take a breast. And I'm like, I have a newborn and I want to successfully breastfeed, and I want to get, the baby back on the breast eventually. And so we actually fed baby the pumped milk by putting a pinky in the baby's mouth and then using a 3cc syringe to feed the baby, kind of like you would feed like a baby kitten or a baby animal, right? Just because, from my reading that, they're more likely to go ahead and accept the breast because, just having a little bit of pinky is more similar to a nipple than say a bottle would be. And I really just didn't want to introduce those kind of more artificial or bottle feeding things just because I really, really wanted to get baby back on the breast, and I didn't want to do anything to, affect that. Trying to syringe feed a newborn baby around the clock, and we ended up doing it for 8 or 9 weeks, is one of the most exhausting things. I think a lot of moms know how exhausting just pumping is in general, right? But then you're spending all this time pumping, but you have to feed a baby very slowly with a syringe, and so that was a rough time. It was very emotionally draining, but I really just tried to stay persistent in trying to work towards that end goal of getting baby eventually back on the breast. I was mentally prepared to exclusively pump, but like I said, that wasn't really the way I wanted to go. So, I do all my internet research, and I ended up finding out that there was a few people who had Raynaud's and were able to breastfeed by taking a medication called Nifedipine. I'm not sure if I'm saying that correctly, but it's basically a blood pressure lowering medication. And when your blood pressure is lower, I actually had really low blood pressure through pregnancy, and just normally I have healthy to low blood pressure. But they say that, with lowering the blood pressure medication, your blood vessels are able to dilate more, which helps the blood flow to the nipple better, and especially to those extremities. And people were able to subsequently breastfeed. And I discovered this. I was like, okay, well, we're gonna have to go talk to my doctor. And I really kind of hemmed and hawed about this because it wasn't something I wanted to do, right? And no one wants to go to a male doctor and sit here and talk about people that can't breastfeed, right? Like, it's a little embarrassing, and just being, so fresh postpartum and a new mom, first time mom. But I decided to go ahead and do that, and one of the things is like, it's funny because when I have shared this story with friends or other people who know me, they're kind of like shocked, like, you took a medication? And they're shocked because I am known as, that organic, natural, what a crunchy mom or whatever. I am very natural, and I like to avoid any kind of unnatural substances. And, especially when it comes to my babies, I try to, give them more of that lifestyle. And so they're very shocked, to remind us, we don't live in heaven. We don't live in paradise. We don't live in a perfect world where it's, super pure or clean or, without toxins or without challenges. But it's kind of been my belief that, even though we face these challenges, and even though we may have to sometimes make, especially as moms, right, we have to choose the less evil. And for me, that was when I was weighing those decisions, I said to myself, okay, either I can hopefully short-term take a medication that is, relatively safe and nurse my baby, give my baby my breast milk for as long as I can, or the other option is to just go ahead and put my baby on formula, because pumping is really difficult, and I don't know, I probably would have really tried to do that long term, but I also discovered later down the road that I actually only respond to the pump for usually about the first 6 months postpartum. So that likely probably wouldn't have been a long-term option for me. It was an easy choice, but you know, I was really uncomfortable with the ingredients in formula and where they come from. I was formula fed, so I mean, there's that too. Like I said, there's no judgment. Everyone is dealt different cards, and we have different experiences, and we have different feelings on things, and we can have different opinions on the same topic throughout different times in our life. We can feel different ways, and you know, that's how we grow, and that's how we learn, and that's how we change, and that's okay. You don't have to always feel the same way about things. There would be no growth or development if you couldn't change your mind on things. And like I said, normally I'm not someone who would go with a medication. I would pretty much rather do anything before taking a medication. So when I was put in this situation, this wasn't an easy decision. It wasn't a decision I wanted to make, but like I said, for me, I wanted to pick the less of the two evils, and I know there's amazing women who have donated to babies and they're wonderfully healthy and all that. I just didn't feel like it was the next step for me. I really felt like I needed to take my experience all the way to it was absolutely not going to happen for me before I was able to consider other options. You know, ultimately my fate. Just want to throw that in there because like I said, you know, motherhood's challenging, and you're not always going to be served these perfect opportunities or these perfect situations. And that's not to say that motherhood isn't a great and wonderful time. But just as we are growing people, you know, we're also growing ourselves. You know, I think it's easy sometimes to see nursing moms and just say, oh, well, it was easy for them and I'm different, or, you know, I had a challenge and other people don't have a challenge. You know, today, right, if you would see me, I do not need any medication to breastfeed. I have nursed now 3 babies. You know, a new mother who doesn't know me would say, oh, well, you know, she just has it easy and da-da-da, not knowing the story behind challenges I had to overcome. And so that's why I just kind of want to also, you know, remind you that, you know, yes, take your time and grieve and cry and struggle and do whatever you need to do, but find that support. You know, take it as a challenge, overcome it, use it as a part of your story of what you learned from the experience. And that doesn't even just mean if you successfully breastfeed, but even if you don't successfully breastfeed or you haven't in the past, what did you learn from that experience? I had shared earlier that for me, I really learned to speak up for myself and advocate for myself and advocate for my baby. And it was a very personal growing moment for myself. And, you know, just turning those lemons into lemonade, right? You know, coming from a place of gratitude and learning sometimes can kind of soften the wound, if you will. So I could actually physically see when I was pumping that the would turn like either a bluish purple or even just go completely white. So I was able to just visually also confirm, you know, luckily with, you know, a pump in modern times, that yes, like I was losing the blood circulation while, you know, pumping or breastfeeding. But that's not always the case with Raynaud. Sometimes you can't visually see, so that's just another thing to kind of note. So we go to the doctor and I kind of, you know, tell him the backstory with a lactation consultant and things, and he had never heard of them using Nifedipine as another way to be able to breastfeed with this, but he's also never seen a patient with Raynaud's in the breast. But just based off of the information I was able to share with him about losing the blood flow and the extreme pain and lactation consultant, you know, giving him all that information and talked to him about it, he agreed that this is something that I should try. And he did put me on the lowest dose and suggested that I actually start with about half of that. So I think the lowest dose is like 30 milligrams or something, but I am a smaller person and I'm more sensitive to medication, so he recommended, you know, I just break them in half and try that at first. I didn't know this at the time. My doctor is very pro breastfeeding. His wife had nursed all of their kids, and his daughter, who is, you know, now grown, was also very pro breastfeeding, and she's a doctor also in the practice. So, you know, I didn't know it at the time, but I guess I kind of had this guiding light of, you know, protection around breastfeeding, which probably, like I said, also contributed to my experience. And I'm fortunate that my doctor wasn't against giving this a try, even though he had never seen this, that he never experienced this. That's to say that you need to be your own advocate. It's not that doctors are necessarily ill-intentioned, But doctors are people too, right? They don't know everything in the world, and having Raynauds and breastfeeding is sometimes a thing that doesn't even cross anybody's mind. If your doctor has even diagnosed you with Raynauds, they might not know that there's another option in order to treat this. And like I said, they'll just say, well, you need to feed your baby, so go ahead and top up with formula, or just go completely to formula because you're kind of a lost cause. And the breastfeeding experience isn't going to be handed to you. Do some women, does it come very easy and they have a natural, transition? Of course. I think in our culture today, especially in America, right, is like we kind of want everything handed to us, and we just think that, everything is going to come to us or it's going to be easy. And, we don't take responsibility maybe for doing all of our research or into being our own advocates and taking responsibility of saying, I'm in charge of my health, I'm in charge of my well-being, I'm also in charge of now, right, this new human being. And so I really think going in, like I said, with my mindset of looking at it more of a challenge and taking more of a responsibility role into, my situation and being an advocate for myself. And yes, like I said, I was fortunate. I had, the support behind me, and my husband was supportive, and my doctor, also, agreed. But people ask me, what would you have done? How would things would have turned out if your doctor would have said, no, I've never heard of that, and that's crazy, or, just kind of brushed me off and didn't give Nifedipine a chance. And to that, I kind of want to say, I probably, honestly, would have kept going to different doctors until someone was willing to listen to me and really do their own research into Raynaud and look into something, even if they may not have learned it or knew about it or weren't familiar with it. Because there is actually literature out there supporting the use of Nifedipine because it's considered a safer drug in terms of how much, I think it was less than 1% that transmits through the breast milk. But it's just not commonly used for Raynauds, and Raynauds isn't a common phenomenon. So when you're kind of like this, I guess, medical outlier, right, you really need to take responsibility and take control of your health and well-being and be an advocate for yourself. So with a lactation consultant, I want to say that we did try heat, we did try using a nipple shield, we tried a lot of natural kind of off the top of your head things, and none of them were successful for me in terms of helping the pain. My kind of tough love moment really, I think, was a positive experience for me overall as a new mother, because before I might not have spoken up and I might not have, really done anything about it, but I felt a lot of responsibility towards my baby, and, I wanted to champion for her, and I wasn't going to just take, no, you just can't do it. It didn't really seem logical to me. Like I said, I had no problems through pregnancy, no real health problems otherwise. I had a home birth, there were no reasons I could see that I shouldn't be able to breastfeed, and I was really willing to try anything to be able to do it. I got home and I took the half of the lowest dose, and I felt like awful. It had lowered my blood pressure so much, I don't have a measurement, but I had like an extreme headache, felt really sick and awful. So even doing half a dose was way too much for me. I felt really sick, had to drink a lot of water with a little bit of salt to try to get my blood pressure up a little bit, just to really be able to feel normal. We cut the half bill into another half, right? So I was taking a quarter, and with taking a quarter, most of the headache was gone. Started with putting the baby latched, at first with a nipple shield, and I could nurse without any pain. I couldn't nurse without the nipple shield without any pain, but I was able to nurse with the nipple shield and had, no discomfort. So that was, for me, if I had just have to use a nipple shield for the rest of, my time nursing, then I was happy. I was fine with that, honestly. that would have been fine for me. I was just happy to, experience having my baby latched and drinking and being satisfied and content. I want to say it probably took 3 or 4 days of taking the quarter piece of the Nifedipine, be able to then get baby latched without a nursing shield. And I was able to go on in my journey and nurse without a nipple shield and without anything, without a breast shield. So I went on and I successfully breastfed that baby full term, which ended up being 5 years, and that was really wonderful. Even though I was on the Nifedipine, I didn't want to be on it long term. I was really hoping that, you know, I would be able to get off it, because even though baby's only getting hopefully less than 1%, I'm a very natural person and I don't want any kind of toxins going into my body. I took the Nifedipine. I was trying to like wean myself off it. I think I was on probably the quarter piece for a week or two, and then I slowly started weaning off of it. So we're literally, you know, chopping it up. You know, we're literally chopping it up into these like, you know, minuscule pieces. But I think after, it took about 4 to 6 weeks maybe to get it off of it completely. And I subsequently was able to go on the rest of my nursing journey without ever having to take it. So that was really great, at least for that baby. So go ahead and fast forward to baby number 2, and I was still nursing baby number 1. Baby number 2 arrived, I did experience pain, so I wasn't able to, again, put baby directly on the breast. But, you know, I felt a lot more prepared and empowered this time to go ahead and get the medication. The great thing that about this time around, you know, the second time around, is that I couldn't even tolerate a quarter pill. I was barely being able to tolerate like an eighth of a pill, just because of the headaches and it lowering my blood pressure so much. So I was really like having like minuscule powder pieces. I think I used like 1 or 2 pills the entire time because I was taking such a little amount, which was really great. And I also was only on it for I think about 2 weeks, and then I was completely off of it. So such a difference even from the first time, right? You know, yes, both times I was taking very little, but my time that I could take it and wean off of it was considerably shorter this time around. So that was really encouraging as well. Now go ahead and fast forward to baby number 3, and I was actually able to put baby on the breast directly after birth. So, you know, I was so happy. I mean, honestly, this was like the best situation that probably I could have experienced. Was it easy? No. Was it what I ideally wanted to do? No. But I'm so grateful and honored to be able to nurse my children, because I know there's so many people who struggle with it for one reason or another. And I just want to, you know, pay it forward and share my story. There's not too much out there about nursing mothers and Raynauds, and unfortunately, most of them are negative stories that mothers that ended up not having any nursing relationship, and also mothers that have very short ones. So I just want to share that it's possible. It's possible to not just do it for a limited time, but to do it as long as you want. I hope you guys found this helpful. Let me know in the comments below if you found this story inspiring or helpful. You guys go ahead and like and subscribe so I can continue putting out more Chinese medicine and natural mothering content for you guys. We'll go ahead and see you next time. Bye-bye, guys.